Good morning. All right. Welcome to the 9th Annual Pathways to Hope Conference. My name is Jessie Higgins. I'm the Chief Mental Health Officer for the City of San Antonio, and I am so thankful to be a part of this conference planning committee and to bring you the information and the knowledge and the wisdom that this panel is going to give you. Today we're going to talk about navigating youth mental health services. After this, we have a very similar topic of navigating youth mental health crisis services, and a third session today will be about navigating youth substance use treatment services. These are, you can come to one or all three. You're already here for the first one, we appreciate it. But the point of these panels today, and these three, is that we want to give you really concrete information. We want you to leave with phone numbers, addresses, resources, information that you can take back to your home, your family, your community, your work, and have a better understanding of these three systems. So very thankful to have this panel of lovely, smart, funny, gracious women today. Truly an honor to be with them. A little bit of housekeeping about CEUs. So we are asking, you will get CEUs through the Whova app. So if you are expecting to get CEUs, you will get it through that app. If you're already signed in, you're good. At the end, I will show a QR code and you will have to take that survey. You are more than welcome to take the survey just to give us feedback. We want to hear your feedback. It's really important to us that we hear that feedback from all of you. But of course, if you know that you get CEUs for your license, you know that that survey is tied to getting your CEUs. These sessions are about 60 minutes long. We'll go until 11:30, and then we'll have a short break after that. And you can get a total of 4 CEUs today, which will be every session. There's 4 workshops today. If you have any questions, come find me at the end and I'll help you navigate the app. I am also a licensed professional counselor and a licensed marriage and family therapist, so I will be navigating it with you, and so we will make sure it works. So now it's my pleasure to introduce the panel, and then we'll get right into it. So first, I have Leah Rosenauer. She's the president and CEO of Girls Inc. of San Antonio, and she has more than 20 years of progressive philanthropic development and management experience. Prior to working with Girls Inc., she had a broad career in nonprofit management, including working with Project Mend, the Girl Scouts, both in San Antonio and in St. Louis, Missouri, and with the National MS Society. She was named the 2018 Nonprofit Senior Manager of the Year by the San Antonio Business Journal. She is a graduate of Leadership San Antonio class of 44 and a graduate of the City South Leadership Academy and the Women's Chamber Level 5 Leadership class. She's active in the San Antonio community. She volunteers with various community agencies and serves on numerous citywide initiatives, including the Digital Inclusion Alliance of San Antonio, Alamo Area STEM Ecosystem, and the Excel Behind the Bell leadership team. She's a sought-after speaker, and she often shares her message of girls' empowerment at local, state, and national meetings and conferences. We're thankful to have Leah with us today. Next, we have Veronica Salgado. She has over 20 years of experience empowering children and families from the San Antonio community. She is a native of San Antonio, and she was the first in her family to attend and graduate from college. She is currently the Director of Behavioral Health at Family Service Association, in which she has worked for 18 years in multiple roles throughout her tenure. She is a proud graduate of the University of Incarnate Word and Webster University, where she obtained her degree in counseling. She can be found at the beach or on a cruise with her family and friends in her free time. Thank you, Veronica. Next, we have Mary Beth Fisk. She has more than 40 years experience in the nonprofit sector as a visionary, executive, clinical research scientist, and a community builder. An active volunteer, Mary Beth was elected to the Ecumenical Center's Board of Directors and has served on several local and national boards. In 2009 and in 2012, she was named a healthcare hero in the areas of innovation and administrative excellence by the San Antonio Business Journal, and also received the Business Journal C-Suite Award in September of 2022. For the past 10 years, Mary Beth has served as the CEO and Executive Director of the Ecumenical Center for Education, Counseling, and Health. She has expanded the business from one main office and a satellite office to an organization with multiple locations throughout Central and South Texas, providing mental and behavioral health services to many under-resourced communities. Mary Beth was instrumental in facilitating the center's prompt response, providing counseling services after mass shooting events in both Sutherland Springs and Uvalde. Thank you, Mary Beth, for being here. And Delores Haines has been a licensed marriage and family therapist for over 20 years. She is the clinical director for child and adolescent outpatient services at the Center for Healthcare Services. Ms. Haines has spent the majority of her career working with children, youth, and families. She believes that a family is a crucial element in the treatment of children and youth. Even though she is not delivering services directly to families at this time, Delores' goal is still to help people make positive changes in their life, calling on the strengths they come in with and helping them build ones that will help them succeed in the future. Delores is an active member of her church and enjoys serving alongside her husband of 30+ years. Fun fact about Delores, one of their original country songs briefly made the top 100 list in Sweden. Delores and her husband not only write music, but also sing and play music together. Unfortunately, that's not what we're doing here today, but maybe next time. So thank you, Delores, for being here. So we'll go ahead and turn it over to the panel. Like I said, this is a very information-heavy panel. We want you to feel comfortable taking pictures of the slides. They should be available on the app as well, but we will have some time for questions at the end, and we hope that at the end of this session you have a better understanding of how to navigate youth mental health services. So I'm going to pass it on to Leah first.
Thank you. Thank you for being here, everyone. Good morning. Oh, no, better than that. Come on, good morning. Good morning. Thank you, thank you, thank you. I have the honor and privilege of being the president and CEO of Girls, Inc. of San Antonio. You see our mission on the slide up there. My job is to help inspire all girls to be strong, smart, and bold. All right, so now I'm going to ask you to say that with me. So the Girls, Inc. inspires all girls to be strong, smart, and bold. So thank you. So if you don't learn anything, you know what our mission is. We work on the whole girl. So I'm often asked what strong, smart, and bold means, and you'll see that definition here on the slide. Healthy, educated, and independent. And we're going to talk about healthy today. But strong, smart, bold, healthy, educated, independent, we're not that creative. So 3 and 3. How many of you had heard about Girls Inc. before you stepped in here today? Oh, I love that. That makes me very, very happy. What we say about Girls Inc., what sets us apart is the Girls Inc. experience. All right, it's 3 things, and you will understand this innately. People, environment, and program. We'll talk a little bit about the programs that we provide, but it's really about the people we put into the girls' lives, right? The people and the environment we create, that safe space. You know, when we talk about navigating mental health services, safety is paramount. And so we want the right people in the right environment, providing the best program we can. So just a little bit, we serve all girls in Bexar County between ages 6 and 18. I say that, you know, we all have limited resources. We try to serve as many as we can. We do that in partnership with schools and community organizations. We have after-school clubs, leadership clubs, peer support groups. We do spring break camp, summer camp. We do mentoring. It's about positive adult role models. This logo at the bottom, I am proud to tell you that we are celebrating 20 years in San Antonio in 2024. So it's our anniversary, which we love. So why behavioral health, mental health? Just a quick stats, you will not be surprised. So when the CDC released their report in 23, it showed that data indicated that 57% of US teen girls felt persistently sad or hopeless, double that of boys. 13% of teen girls indicated they had attempted suicide in the past year, double the rate of boys. 54% of the teen girls reported feeling persistently sad or hopeless every day for at least 2 weeks in a row, feeling so prevalent that they stopped regular activities. I bolded that because, you know, when you're growing up, you know, activities are important, being around friends and doing things. And as we know, feeling so sad, that the persistent feeling that they stop doing their regular activities. And this is tough stuff to talk about, right? But we knew this was an important topic, pre-pandemic. We now know it's even more important post-pandemic. And the stats, just reinforce what we already knew, that this is important to talk about. So we want to help. Part of the reason why I'm going first is we do most of our work upstream, okay? Our goal is to intervene with girls and young women earlier before it becomes a crisis. All right, that's our goal, to normalize these conversations, to talk with families about mental health, to provide that trusting, safe space so we can provide services and support, ideally, before it becomes a crisis. So that's what we do. We mentor psychoeducational programs, girls-only environment. It's intentional. We want girls safe, learning, and talking with us. All right, I want you to walk away immediately with a free resource, okay? Immediately. So Learn to Live is an app. Okay, another app to download. But our national office has partnered with Learn to Live. I have to look because I always reverse it. And it is they are a leader in behavioral health challenges, digital platform. They have coaching. They have little mindful moments that they'll text you. They do cognitive behavioral therapy. They have programs in English and Spanish, which I really appreciate. And so all of the things that we know our girls and young women are going through. So anyone 13 and older, all right, can download the app and take advantage of this. So you'll see some of the directive programs. We all know these are prevalent. The next slide will tell you how to access this. And if that QR code is too small, there's a flyer outside. It's the green flyer. Oh, thank you. Yep. So there's a flyer outside, or you can log in, learntolive.com/partners. The access code is Girls Inc. So please know that that is available. So download it, use it. If you end up not using it, whatever. But it's something that is there right now. If you just want to ask a question, if you just want to watch a webinar, I want you to be able to walk away with some kind of resource that you can activate now. Okay, now, come to us. We have two main programs in this behavioral health and wellness field. One is Striving and Thriving, and I also reversed those for some reason. These are weekly workshops for girls ages 11 to 18. They're placed in peer groups to work on concrete skills about navigating adolescence. But what I love about Striving and Thriving is there's a caregiver adult component. So as the girls are with us in peer support groups, their caregiver, their family members, parents maybe, are also in a group to learn support for each other and how to support the girls when they're not at Girls Inc. So one of the things we talked about when we started this program was recovery from the pandemic is more than just working with the girl. It's going to take the whole family, and whatever family that looks like to them. And so this is now our way to build that into the program. So there are flyers outside also, because when I did the slide, the QR code wasn't ready. So there are 3 groups, and they're outside, so you can pick one up, and please share that. The second program we provide is Bold Connections. We use bold a lot in our titles. I like the word. So these are monthly peer groups and more Zoom gatherings. This is just a safe space for girls to just talk. It's a little less structured than Striving and Thriving because we want girls to just be girls and have a safe space. So past activities have included gratitude journals, yoga, navigating friendships. So it's a little less formal than Striving and Thriving. So that's also available to girls in grades, well, 2 groups, 3 and 5, and then 6 through 8, so elementary and middle school. Okay, Striving and Thriving goes all the way through high school. Flyers outside, QR codes, these are free. And our whole motive for doing this is to have girls be willing to talk and learn, and then ideally help their families with even more services that they need. So that's what we do. I'm honored to be here. Ask me any questions. The amazing ladies on the panel we partner with all the time. Many of our partners are in the audience here. And remember, my challenge to you is to tell a girl in your life, okay, daughter, niece, neighbor, granddaughter. So go home today, this weekend, and tell a girl in your life that she is strong, smart, and bold.
So here's the information for Girls Inc. And again, we'll take questions as at the end as a panel. So save your questions for Leah if you have any. Thank you so much. And thank you so much for that resource. Like she said, there's flyers and it's the slides should be in your app as well. All right, next, Vero, it's you. Surprise.
Hello?
Yeah, you got it.
We're working. Hello, everyone. Thank y'all for being here. I'm excited to be up here with this wonderful panel. I am for Family Service. We are one of the oldest human service nonprofit agency. We've been around since 1903, and we provide services. As you can see, our mission statement is to empower individuals and their families, and our community. So we provide services, wraparound services from prenatal and all the way up to older adults. And so we have a variety of services that we offer. Our website will be up in a little bit. You guys can take pictures of that. You can go to our website and it shows all of our services, all of our departments, everything that we provide to our families in the community, just here in San Antonio and also in the rural areas. So we go down south a little bit to Uvalde, Crystal City, Eagle Pass. We have services down in that area as well. If you have family members or know of anyone that's down south, we are also down there. I am here today to talk about our youth mental health services. So part of our counseling department at the agency is a legacy department. We've been providing counseling services for 8-year-olds and all the way up to adults, individual, family, group, substance abuse, domestic violence, a little bit of everything that we offer at our agency. The school-based mental health service piece, we just started in 2019. We started a partnership with a group of students from South San ISD. So if anybody is here from South San, little shout out, yay! So a group of students from South San ISD got together and they said, you know what, we need more. We need help. The school's not giving us enough. They're giving us some support, but not enough support. And so we are one of several nonprofits that came together and said, what can we do? And so we did just that. We hired on staff, licensed counselors, and made them mobile. So now our staff go out to the schools, they go to the students, they meet the students where they're at, they do home visits with the students and their family if needed. And so we really wanted to provide that wraparound piece, bring it to them instead of them having to come to us. As we all know, transportation is always the #1 issue. You know, the kids really want it, but the parents have to work and they can't get them there to their appointments. So we really came together and said, what can we do? And so that's part of the work that we started at South San ISD in one school district in 2019. Now, Family Services providing school-based services in 8 school districts across San Antonio. So we have really grown, thank you. The team has done a phenomenal job. We have really grown, and we have provided services to over 1,000 students each year since then. So we know the need is there, especially right after COVID hit. The need grew extensively, and our team also grew with that to be able to provide those services. And so you can see up here, these are some of the school districts that we are in: South San, Somerset, Southwest, and Alamo Heights. Some of these school districts also did create their own kind of care center, so it's kind of an off-site location. It's more private, it's more confidential. Our staff can go and meet the kids there as well, or families in the evening after they get out of work or before they go to work. And we also work with some of the staff at some of the schools. So the teachers, the staff reached out and said, we need help too. So we also provide that confidentiality for them so they can come off of their school, come to the center, they can come to our office, or they can also do telehealth services. And so that really keeps them aside if they don't want people to know, you don't want your peers to know that you're getting counseling or that you're asking for help. We try to make sure that all that stays confidential for them. And so up here is our contact information. You get a straight direct phone number to Gloria Sanchez, who is the school-based coordinator for us. Her phone number is up there, and I did warn her before I came that I was gonna pass it out like hotcakes, so she's expecting that. Also, if you have students that are at any of those schools or your clients are at those schools, they can go either to their school counselor, to their teacher, and ask for the mental health services with Family Service, and they'll point them in the right direction. The second part of our school-based services, and this is more part of the collaborative that was created, the Mobile Mental Wellness. If any of you have heard of that or familiar with that, so that is the piece that grew out of the South San ISD group. We are now servicing SAISD high schools only at this moment, but eventually hoping to branch out into the middle and elementary schools. Harlandale ISD is all grade levels plus parents and plus staff and faculty. Edgewood ISD is the same thing, and we are also at Judson ISD. So we are kind of spread out all throughout San Antonio and Bexar County, even to little rural areas. So up there is the same thing. You can contact the school counselor, any one of their teachers at any of those campuses. Our staff go to each and every campus, elementary, middle, and high school. And so we are working with everybody across the board. Gloria's number is also up there again for this. And then I've also included our mental wellness collaborative website. If you have questions, if you want to see if your student qualifies, you can go to that website and input their information, and then an email will get sent to one of us, and then we take it over from there for the referral process. Okay. The mental health services, just kind of in general, like I said earlier, our behavioral health services is a legacy program at Family Service, and so we provide services 8-year-olds all the way up to older adults. In the office, we have 3 office locations in San Antonio. One not too far from here, down the street on San Pedro, is our main location. We have an office on the west side of San Antonio. We call it the Neighborhood Place on Rivas Street, if anybody's familiar with that area. We transformed an old elementary school into a community hotspot. And so it's anybody can walk in from the neighborhood, ask for questions, ask for help. And if we can't do it with Family Service, we have other partners that are housed out of that building. And so, we will find what you need or what your families are needing. We also have an office off of 410 and Parent Vital. So we're a little spread out throughout San Antonio to make it an easy access to all of our families that come through for services of our agency. We take multiple insurances. So if you have an insurance, you're looking for mental health services, you want to contact Teresa Punches. Her number is up here also. She is our billing specialist. So she's the one that will kind of do the research for you to see if your insurance takes it, how many sessions you get, and how much your copay would be. We also do it based off sliding scale fees. So if you come in, you tell us I don't have insurance, but here's my income and here's my family size, we will figure out just how much it would cost for you to get services. It can be as little as $3, $5 a session, up to $20, $25. We work with everybody that comes through. And we do not turn anybody away. So if you do come and say, I have absolutely nothing to pay, we're not gonna send you somewhere else. We will still work with you and provide free services as needed, or as we have the capability to do that. So that's just kind of the services that we have at the office. I listed some of the symptoms up on the screen, but we take everything and everything. If you just want to talk to somebody, you can come in and just talk and sit and chat with somebody. If you're stressed out about work life, relationships, your children, anything and everything, you can come reach out to us and we will get you situated with somebody. The next slide shows the exact addresses to the 3 main locations that we talked about. It also has Teresa's phone number up there as well, and then that is the website straight to our behavioral health page on our agency website, so that you guys can have that also. And the last page is my information. If you tried all these accesses and you couldn't get what you needed, you can definitely call me or email me or look me up or come find me at San Pedro, and I will help you guys and we will work through it together. Okay, thank you so much, and thank y'all for being here.
Thank you. Speaking of bold moves, we have, I think that I heard yesterday the count for the registration for this conference was 1198. So prayers for Teresa, who have access to her work extension. But we appreciate I'm confident, and I know each one of you in your agencies really well. These are the people who do want you to call them, maybe not their cell phones at night, but call them directly and advocate for your kids, for your families, for your school districts, and figure out, these are people who say yes, and how do we figure out how to find a way? And so thank you for that. And again, we'll remember Teresa in our minds and in our thoughts. Mary Beth, you're next.
Well, thank you so much. Hey, everybody, how about a shout out to our leader of the workshop today and moderator, Miss Jessie Higgins. Jessie's incredibly on top of all the wonderful things that she brings. She's also very organized. And so, yay, Jessie. So I'm Mary Beth Fisk. I serve as the CEO of the Ecumenical Center, and I'm just very humbled to be present with the panel, with those here on the podium today, and with each of you who are here to advocate on behalf of your own families, the people that you serve, the people in your congregations, those who are in need. And so I'd just like to give you a quick snippet of the Ecumenical Center. It's a long word, it's hard to pronounce. And so there was a bit of legacy. The center was founded back in 1967 by a group of clergymen who said there needed to be a place for hope and healing in our community. And particularly, they said there needed to be a place for hope and healing in the Oak Hills Medical Center community. How many remember what that was? Only me, okay. So we're just again, very humbled to be here with you today. Our focus of our conversation today is on youth and youth mental health. We know that 1 in 5 youth struggle with mental illness in our communities. And we know that if we can go upstream and provide services, as our colleagues will talk about, have talked about today, that they have a greater chance at being able to have a successful life and a healthier family as well. The center actually does serve all ages, so from 3 to, let's say, 103. We work very closely with adults, I'll just mention that briefly, with families. We work very closely with our active duty military and our veteran communities and their families, with victims in our community. I know many of the organizations represented on this stage and in our audience as well work with victims of crime who have distinct needs, particularly from trauma and being traumatized. So we focus in different areas, and so I'm going to turn our attention when talking about the Ecumenical Center's resources to our youth-serving resources. So we provide clinical service from licensed clinicians, that's LPCs, clinical social workers, play therapists, art therapists, music therapists, psychologists, and the like throughout our community. Every year we serve 26,000 individuals across South and Central Texas, and I'll share with you a quick map of that in case you're not just from the San Antonio area, that there are other resources available through our collective organizations. But 13,000 of those are youth and children. And so the areas that seem to work very well with our youth on an outpatient basis include our adolescent counseling. Our adolescents love to walk and talk. They like to be in motion. They don't necessarily like to sit still. And I see lots of heads nodding. We understand that. So part of the clinical experience can be in nature. So walking trails with your counselor. There's ways that we can think of doing and providing these services that go outside of what we would traditionally look at as walking into an office or a medical building and talking with a counselor. So those are just interesting things that we want to take into consideration. Play therapy. These are for the youngest among us. And our children cannot necessarily find the words for what's troubling them or what's hurting them inside, but they can find the way to play that out. So special tools, toys, are selected, and therapists that are specialists in play therapy can interpret what's on a child's heart, what is troubling them, and help their families and their parents find a way, a pathway forward to understanding what's happening and then providing ways in which to create healing in that community of their family. Art therapy, music therapy, I think we kind of all know what those are about, but sometimes we just don't want to walk in and sit down and talk to a counselor, right? But music may be my portal. Art might be Leah's portal into telling your story. So however you can reach in to get services from all of our organizations through our psychological profile with our services and so forth is really very, very important. We'll go to the next slide. The clinical services that we speak of are provided by 38 clinicians at the Ecumenical Center each year, and we do have a sliding scale, and that's important to note. Jessie mentioned that. There's no wrong door. We can always find a way to help, and that's what we want to impart on you today. If you know of someone who's struggling, or if you're struggling, please reach out to any of us on the podium here today and our colleagues out in the foyer with their tables, because that's why we do what we do. The support groups are really important. For some, support groups are exactly what they need, in exactly the right time and exactly the right moment. One of the programs that's very successful and well followed is our grief support group programs called Life After Loss. This is for all ages. We do differentiate ages. So if we have youth, they're with youth. If we have adults who have lost a spouse, they're with adults who've lost a spouse. So there's some common ground that we know we've experienced a grief situation. And the group is 6 weeks in length. And just briefly, that 6 weeks has a beginning and it has an end. And it's okay, because what we don't want to do is perpetuate just having to relive our difficult stories over and over and over again. But if you've gone through a support group, whether it's this grief support group or another, beginning and an end, you can always go through it again, and that's perfectly fine. But we want to make sure to encourage a healthy outcome. Another of the support groups at the center is Solos, and I don't know if many people know the Solos support group in the audience today, but it's the suicide of a loved one. And we may have some folks in the audience that actually have participated in that, but it's a very special group who have something very special in common. And it's very difficult and it's a tough journey. That group meets weekly at the Ecumenical Center. If you need more information about that, please just let us know. Next slide. Peer support. And you'll hear more about that. We've already heard about this, but peer support specialists are very unique individuals. We talked about the term navigation, and peer support specialists can help you with navigation. We also allow them to help with triage. So if an individual calls and can't get in to see a clinician that afternoon, they can see a peer support specialist who can reflect with them, who can help them to be understood in what they have as needs, and to help them find the next step in the journey to healing. Next slide. A unique program that we've partnered with the City of San Antonio is our aging out of foster youth and at-risk youth. And so we're very grateful to have the opportunity of serving this population of our youth in our community. This goes up to 18 years of age. So if you are aware of any youth that need these specialized services, there's no cost at all to these services, and they'll see a licensed provider. We can provide that virtually, in person, at multiple different locations throughout the community. Next slide. This is just a snapshot in time of where our locations are across South and Central Texas. We have 42 different locations. Some of them are in schools, in rural districts as well, in congregations who perhaps have space that they're not using during the week, but they use it on say, the worship days, Friday or Sunday. But it's a perfect opportunity to be able to have infrastructure, to be able to provide a neighborhood place for coming and being able to get the help that one needs. One of the things that we've all collectively, I know, here on the podium today worked in is trauma-informed care. And trauma-informed care certification. If you haven't heard about that, that's not our topic for today, but please see me after, and I'd love to tell you more about it along with our colleagues here. But trauma-informed care is very unique in that the principles of this look at not necessarily asking the question, what's wrong with you, but instead what has happened to you. And so very unique to our community, to our county, to our city, an effort to achieve trauma-informed certification for not just mental and behavioral health organizations, but for every kind of a business, a school, a congregation across the community, so that we don't stereotype, that instead we welcome and we're engaged with the individual and engaged with their needs, which takes into account physical, emotional safety, trustworthiness, peer support, collaboration, empowerment, voice, and most importantly, equity and inclusion. and cultural principles by which one would allow themselves to receive care. My last slide today is to talk a little bit about trauma-informed care and an area that we work with some of our youngest children, and particularly, I should say, our child care workers work with the youngest children, most impressionable developmental age. There's a new program for training and certifying those individuals. So if you know of anyone that is in the child care realm that has an interest in engaging into a kind of a career ladder, if you will, and learning more about trauma-informed care and how to interact with the child, also the parents and the families. Sometimes that's their hardest thing to do, as I understand it. That's another of the programs that can help us get to a healthier place as a community and provide the care and the nurturing that our children most need. And so I'll stop there. I put up here the telephone number to the center, but I will be happy to give you my cell phone number, and yes, you can call me at 2 a.m.
So one thing, hold on, before you pass the mic, my church, Trinity Baptist Church, wanted to start a grief support group. And so not only does the Ecumenical Center provide that if you wanted to go there, but they trained leaders at our church so that we can provide that in our church. And so that's another resource. And then can you talk about the peer support group for licensed professionals? Because I think that's something that we definitely need. If you're a licensed professional in the room, I hope you have a reliable group of people that you can go to for case staffings and support and self-care. And I think the Ecumenical Center is one of maybe the only place, but definitely a very reliable place that provides that. So if you could talk about that.
Thank you, Jessie. Yes, if you're a licensed professional and you have an interest in growing your knowledge, learning from your peers, in the community, we have a weekly program. It's a staffing on Tuesday where we come together. Each individual that's a part of that group will take an opportunity to give a 30-minute briefing on something that they've just recently learned about or that they've practiced for a long time to help others learn. And then we go into case studies. Most importantly, and I think why Jessie brings this up, is self-care. And we can be weighted by all the trauma, and for the clinicians and peer support specialists that are out today and my colleagues on the platform, we learn strategies. Part of what our programs do is teach us strategies in how not to carry those things home. But we are human, right? And so being able to find an outlet that you can have that's trustworthy, that's in compliance with HIPAA for confidentiality is critically important. So if you want more information on that offering, please let us know. Also, continuing education is a big part. There's an ethics conference for clinicians coming up very soon. Some of you may have attended Kenda Dalrymple's programs. She's an attorney from Austin, but she's very, very knowledgeable. And so she'll be actually at the Ecumenical Center on November 13th, providing an all-day workshop on the topic of ethical practices and principles that are relevant today in mental and behavioral health.
Thank you. Yeah, thank you so much. We know that a big part of the struggle that we can have in our mental health comes from isolation. And I think as professionals, when we're making decisions and when we're working in isolation, that's where we can get in some ethical hot water. Not that we would ever do anything on purpose, but when we're alone and we're struggling and hearing everyone's stories and sometimes having difficult things to handle. So these types of support, I think, are really, really important. And so if that's you, if you're a licensed professional, I want you to know that there is a place that you can go weekly and start developing that network of support. So thank you, Mary Beth. And Delores, take us home, please.
All right. Thanks again for joining us this morning. My name is Delores Haines, and I am with the Center for Healthcare Services. The Center for Healthcare is one of 39 local mental health authorities across the state of Texas, and we are the third largest by population. We offer services, not only mental health services, but intellectual and developmental disability services and substance use disorders. There are over 20 clinic locations that the center has throughout Bexar County, and we have over 80 programs in the community. Often one of the questions I get is, well, how come your catchment area is only Bexar County? To put it into some perspective, Bexar County is the same size as the state of Rhode Island. So we cover a lot of area, and San Antonio is the 7th largest city in the U.S. So we've got a lot of folks here in San Antonio. I am going to talk specifically about our children's programs. In general, in our outpatient programs, if you have a child living in Bexar County between the ages of 3 and 17 that has a diagnosable mental health condition, you qualify for services with us. We do take all forms of Medicaid. We take private insurance. If you are somebody that doesn't have any funding at all, we will certainly provide those services to you, and we can connect you with our client benefits officers who can help you get that funding started for yourself. And one of the reasons that the focus on mental health is so important for adolescents is that fully 50% of mental health symptoms start to develop before the age of 14. So let that settle in for a minute. Half of the diagnosable mental health conditions start their symptoms by age 14. And our kids are going through so many changes and so many things already that to be able to have a place to talk about what's going on with them, where they're not going to get judged, where they're not going to suffer stigma, is incredibly important. We have 3 children's, good, thank you. We do have 3 children's clinics here in Bexar County. We've got one on the northwest side, we've got one on West Drexel Avenue, and we have one at Story Lane. All of our enrollment services are at our northwest location on Bandera Road, and the enrollments are available between 8 a.m. and 3 p.m. And you can contact us at 210-261-CHCS, that's 210-261-2427, and get connected with those enrollment services. We do the enrollments on what we call a same day, next day. So you would call in, you'll get an initial assessment to let you know whether or not you are, that quick eligibility assessment. And if we've got space to see you that day, we'll go ahead and see you that day. And if not, we'll ask you to come back the next day. And we will see you in person, and we will see you via telehealth. And I know for some of our families, that telehealth option is pretty important because it's less time that they're having to travel across the city. This child is losing less school time, and parents are losing less time at work. Oh, I already went through all of that. So next slide. So what do you need to bring to an enrollment appointment? Well, there are several things that we need. Of course, we need driver's license identification for the parent or guardian. We need a birth certificate for the child, a copy of the coverage card, Medicaid card, insurance card, if you have that. Proof of income or residency, and that can be a utility bill, a lease agreement. We just have to make sure that you are a Bexar County resident. And we do have families that are in Bexar County that come to us from Atascosa. There are parts of Bernie that are still in Bexar County. And there is actually a part of, we've got a family as far away as Lytle they're like right on the county line, but they're in Bexar County, and so come on in. We are here for you. And now I'm going to talk about our numerous child and adolescent serving programs. On our outpatient, in our outpatient clinics, we do serve, like I said, children between the ages of 3 and 17. And we offer counseling, skills training, anger management training, medication training, and psychiatric services. We do, when we are looking at psychiatric services, so seeing a psychiatrist, checking whether or not your child needs to be on medication, that is going to always be in conjunction with other services, because best practice for children is services plus medication. Medication by itself is not an answer for our children and adolescents. And our general clinic hours on the outpatient side, generally 8:30 to 5:30. We do have some folks that are working later into the evening, starting their day at 10, ending their day at 7 o'clock. So we're having some accommodation for later appointments so that we're missing less school and parents are missing less work. We deliver services in person at our clinic, in person in the community, and also via telehealth. So again, we're using whatever options that we have and that our families need to get connected with us. On our juvenile justice side, we are treating our adolescents starting at age 10 all the way up through age 17. And all of those referrals come through our Bexar County Juvenile Probation Department. And many of the youth that are in that program are connected and have legal issues, partly because they've got a mental health condition that has not been controlled. And so they work with a specialized group of probation officers and staff at the Center for Healthcare Services, and they're actually co-located in the same building. So a child can see their probation officer and their counselor together or separately, and they don't have to go to separate places. And that group also travels and does a lot of our services out in the community. And that the juvenile justice has a couple of different areas in it. The juvenile Tacoma program is specifically for those that are adjudicated. The MIND program is part of the boys specialty court, and that's men in need of direction. And those are young men that are going through a court-ordered program. They are sitting in front of a judge every 2 weeks. They're learning they're learning to see law enforcement in a different lens. And it's because it's in the court that they get all of their updates. It's in the court that they progress through the program. And it's in the courtroom that they graduate from the program in front of a judge, in front of their parents, and in front of the people that have provided their treatment. So they're really getting a really different take on what that legal involvement means for them and learning that people really are here to help them. The other piece of the justice program is the reentry court, and that's for the juveniles that have been at the Cindy Taylor Cryer residential facility and have a diagnosable mental health condition. Our job at the Center for Healthcare Services for those youth is to help them transition back into the community with support to the youth and support to the parent with a certified family partner, which is a form of peer support. And the job of the family partner in any case, whether it's with the justice program or with one of our in-clinic outpatient programs, is to help the parent get whatever is necessary to ensure the success of the child and to make sure that the parent gets their own support if they need that. And the last type of program that we have on the outpatient adolescent side is our programs for our tiniest clients, those between the ages of 0 and 5. We have our early childhood intervention program for those between the ages of 0 and 36 months that are also having some developmental delays, and that is a completely field-based program. They're going out to the homes, doing hand-over-hand teaching, supporting those parents, and helping those our littlest, tiniest clients, get on the right road. And the other is our healthy outcomes through prevention and early support program in partnership with the United Way. And that is specifically for those parents that have the little ones that are starting to develop maybe some behavior issues. And the goal of that program is to help parents, one, understand where the behaviors are coming from, and using their own reaction to the behaviors as a teachable moment to teach the child how to appropriately start managing that behavior from a very young age. We also have the Youth Empowerment Services Program, and that's one of our most intensive programs at the center. And that is for youth between ages 5 and 17 who have at risk their current placement, whether that's in a group home with their family or in a foster home, because they're having multiple hospitalizations. And again, that's another one of our programs that has a very, that's one of the programs that's got the largest team, because there's a wraparound facilitator, there's a skills trainer, there's a counselor, and there are additional contractors that go out and see the family sometimes 3, 4, 5 times a week to help get all of those behaviors taken care of and managed so that the family and the child can start stepping down the levels of care and eventually get out of treatment. Because that, as treatment providers, and I think I speak for everyone here on this panel, that our job is to work ourselves out of a job. We want our clients to be in treatment for what they need and out of treatment and healthy and engaged in their community and calling on the natural supports that they have. So give us a call, 210-261-2427. That is the main hub. That'll give you information for all of our children's programs, all of our adult programs. It'll get you connected with our enrollment services, and we are here to serve. Thank you so much for joining us this morning.
Thank you. Yeah, what a beautiful goal that we could work ourselves out of a job, and that we could, I want some job, but we could reduce, the acuity and reduce what we have to provide and the pressure. And so I really appreciate, that perspective. I have a question for you, Delores, because you have the mic, and then we'll go to an audience question. I think a question sometimes that people have is, how do I know when it's time to get my child into some services? Sometimes the question is where, but the before that question is, how do I know what does my kid look like when I'm realizing it's time to go to services?
That is a really good question, and thank you for asking that. So, like I said before, our children and adolescents, just by the fact of their developmental stage, are going through so many changes. They are learning how to think, how to make decisions, how to express their emotions, how to have relationships. All of the things are going on. And there are typical behaviors that are associated with childhood and adolescence, and then there are those that are far beyond and should warrant a conversation. For instance, if you have a child that's a naturally quiet child, but they've got a friend group, they've got a support group, and you see them start pulling away from their friends, which is a big sign, especially for an adolescent, because in that stage of development, friends are so important. So if you've got a child that's pulling away from friends, they're pulling away from family, they've lost interest in things that have always given them happiness and passion, it's time to have that conversation of, hey, I've noticed that these 3, 4, 5, 6 things are different. What's going on? If you've got a child that's sleeping too much, sleeping too little, if you're seeing outbursts of anger that are beyond what is normal, because a 4-year-old is going to throw a tantrum when they don't get their way. And a 2-year-old is going to look at you and say, no, mine. That's what they do. But if those behaviors are crossing that line of what is typical for your child, because parents walk into that clinic and they are the experts on their children, whether they feel like it or believe it or not. And so if you are seeing something from your child that is causing you concern because it's a new behavior, because it's an escalation of a behavior that's previously been well controlled, then have the conversation, make the call, get the assessment, because it might be time to bring in some help from the outside.
And I would say that schools, other family members, other adults, or people who spend time with your kid that you trust may be good places of insight. So we have a few minutes here for questions. We have a couple microphones. These sessions are being recorded. So if you do have a question, if you could use the mic, that way that picks up on the recording. Anyone have questions for the panel? Come on up. We got the first mic here.
Hi.
Hi.
My name is Alejandro. I'm with Girls Inc. San Antonio. Just a question I have, because I know it's some roadblocks. Like, how do you provide, we all provide great services. So how do you reach the families and the youth who can't get that access, who can't go to you, who doesn't know about it, or their culture, they don't talk about it much. And there's that youth that wants to reach out, but they can't. Like, they can't go to you, they don't have the internet, they don't have access to it, or maybe their family prevents them. So, how would y'all navigate that?
Veronica, could you talk about school-based services? I think that's one way that we can talk about that.
Sure. Part of our agency being so large, that's a positive for us. We have multiple programs that are already in school. So we have a youth education team that does after-school programming. They are on the actual school grounds. They do a lot of recruiting during lunchtime. We do a lot of outreach events also. We go to all the back-to-school events on each of those campuses. We are out there handing out our flyers, our QR codes, our cute little crafty things that the kids want these days, the headphones, and to just let it be known that we're here and we're here to support them. It is a little harder for youth to reach out, but if we can grab them from a different program that they're already in, a relationship that they've built with another staff person at our agency, and then we have that internal referral process to say, hey, I have a student that's sitting in our after-school programming that has reached out already and has really asked for some help, and then we pair them up with the counselor that we have on site. So that's kind of how we work it through at Family Services, because we're so spread out and we're a little bit of everywhere, and a lot of our services are community-based, and so we are going out to them, to where they're at and to where they're comfortable talking with somebody.
I think one other thing that I can think of is empowering kids to talk to kids. And of course we want to do that, but there are some also very formalized trainings. One is called YAM, Youth Aware of Mental Health. And because we don't want just a child, a teenager, however old, to feel the burden of someone else's struggles and trauma and things that they have going on. But there are some formalized trainings that we can bring into churches and schools and communities and after-school programs to help kids. We know that kids want to talk to each other. It's easier to talk to each other than adults. And so that's another avenue where we are trying to reach people who, children can be very isolated depending on what their family has access to or will allow them access to. And so I think that's a great question. I'd like to take one more question. It is the lunch hour. We do have 45 minutes though, so I'd like to take one more question. You come on up to the mic. And we'll be around a little bit afterwards. And I've put the CEU code up here. I think if you scroll down to the bottom, there's an area to select this session. So we're just gonna, again, put that on our prayer request list also, that we all get our CEUs and everything works great. This is our first time to use this program at this conference, so go ahead.
Good morning. My name is Reverend Sheila, and I think I heard all of you all say you have Bexar County services. So do you reach out to other areas, other counties? Can you connect people in other counties with services?
So, and I did want to say this about the Center for Healthcare Services only serves Bexar County, but every county in Texas is assigned to a local mental health authority. So if you're south of here, you're Camino Real. If you're west of here, or east of here, you're Bluebonnet Trails. If you're northwest Hill Country, MHDD is 19 counties, kind of covering all of northwest of us. So there are other places, but I'll let Mary Beth, I know you guys, and Family Service also has services everywhere.
Oh, absolutely. So there are many counties. I think we have 48 counties we serve across South and Central Texas. Happy to visit, about the location that has a particular need, but we know the rural communities have significant needs that don't necessarily have fully funded resources. And so being able to augment and work together with the local mental health authorities assigned to those areas. I think we work with 7 different local mental health authorities across the state, just in the catchment area that we have. We'd certainly be happy to visit about the area and what resources are available there. And if we don't have a resource, try to help connect to another agency that does.
Same for us. We have a mini family service down in Crystal City, which is down south, and we just purchased a new building to try and recreate what we have here in San Antonio. And so they provide a majority of the services that we do at a lesser value, not value, but lesser number of clients than we get in San Antonio. But that staff travel, so Uvalde, Eagle Pass, Crystal City, Zavala County, so they kind of cover that south piece, and that's the other half of a family service. And this, same as Mary Beth said, if we can't provide it, we try to make sure that we hook them up with somebody that can.
Thank you.
All right, that's all you've got for you. Please come back after lunch at 12:30, I think, for the next session if you want to hear more about youth mental health crisis services. Everyone have a great day.